Welcome, everybody. Today's topic is the bypass surgery, and with us is Professor Grünenfelder, heart surgeon from the Hirslanden Zurich. Thank you, Professor Grünenfelder, for joining.
Thank you for having me.
Professor, bypass surgery. Can you give us a little bit of insight about the procedure, what you do, how you do it?
Yes, I try.
Okay.
Bypass surgery in cardiac surgery.
Yes, of course.
Is done in patients with coronary artery disease.
Mm-hmm.
If they have severe coronary artery disease and if they're not eligible or not suitable for stenting, they get bypass surgery. And bypass surgery means that we have to implant bypasses to the heart to allow the blood to get into the heart and not being obstructed through the coronary arteries. These bypasses are done with arteries, from the body and with veins from the patients.
You take them from somewhere else, basically.
We take them from somewhere else. Usually the arteries are from the chest bone, as of inside the chest. We call them mammary arteries. We usually take both arteries inside the chest to make the bypasses. And also we use, if necessary, we use the saphenous vein. This is a vein in the leg. We take out this vein to make the bypasses. And it depends on the anatomy and the disease of the patient, how many bypasses we have to place. And these bypasses we place either with the heart-lung machine or without the heart-lung machine. That depends on the patient's status. And we perform this very often. So this is a very well-known and very good treatment for patients with coronary artery disease.
May I just ask, you said you do that for patients that are not suitable for a stent. Stent, I guess, would be, let's say, the easier way out of the disease. What is the reason? Why would a certain patient not be qualified for stenting?
This is always the big controversy between the cardiologist and the cardiac surgeon, or within the medical community. What is the best treatment for patients with coronary artery disease? Mm-hmm. And there have been studies showing that surgery is much better in patients who has a severe three-vessel disease, meaning that all three coronary arteries are diseased. And it has been shown in many studies that in these patients, especially if the patient has diabetes, that these patients fare much better with coronary artery bypass grafting. Mm-hmm. But in other patients who have not such a disease, not such a severe disease, stenting is considered the gold standard and has been performed very often, and is a very good therapy as well in these patients. We have to discuss within our group. So in our group with our interventional cardiologist, we always discuss the patients, what is the best strategy to treat him. And usually it has been agreed that coronary artery bypass surgery is and should be performed in these patients who has, as I said, three-vessel disease, mm-hmm. Extensive disease, and has also the diabetes.
Mm-hmm. So let's go. Thank you for this explanation. And sorry to cut you there a little bit, but I was just interested because we have this request quite a lot of time, and yeah, it's also good learning for me. So thank you for this. So let's go back to the intervention. So you take out veins and arteries, right?
Yes.
And then?
And then the veins we put in, we have to connect the vein to the aorta.
Yeah.
That's why aorto coronary bypass surgery is the name. So we place a vein, connect the vein to the aorta, and then into the coronary arteries, so the blood can flow. So the oxygenated blood can flow from the aorta through the vein into the coronary artery. And that means there's additional blood flow and additional oxygen, supplying the heart.
Wow.
In the arteries, so if we take the mammary artery, the mammary we leave attached to the origin of the mammary artery, and we just reroute the mammary into the heart. So we have just to make one connection to the coronary artery if we use, for instance, the left mammary or the right mammary, and we leave the mammary in situ, so we call it. But we can make arrangements. We can take the right completely out of the chest and connect it to the left. So there are many options we can apply, so that we can perform all the bypasses we want.
Okay, sounds like a heavy intervention.
Yeah.
What's the recovery time for this?
It's of course always depending on the patient, but since we perform usually these procedures through a median sternotomy, because we have to make, if we operate, we usually make 3, 4, 5, 6 bypasses, and on all sides of the heart. So we usually open up the chest. That means the trauma is a little larger than in patients where we can perform surgery through a small incision in the chest. That's why usually the recovery time is a little longer. But again, it's depending on the patient, and we keep the patients a week in the hospital after the surgery, and they usually also go to a rehabilitation facility for a rehab program for 3 weeks.
Okay.
So they're also
4 weeks
out of their usual habits.
Last question, as in every of our heart-related interviews, and as you can see, because to the viewers who are now following, we have different topics that we have been discussing with Professor Grünenfelder, but something that always is the question is life expectancy after bypass surgery. So what are your comments here, please?
If we have to perform coronary artery bypass surgery, the patient has a severe coronary disease, which usually is arteriosclerosis related. Arteriosclerosis is a general disease of the arteries, which we have no treatment yet. We can just slower down the progression of the coronary arteries, which are diseased. But it's not that we heal the patient. We heal. We actually perform the surgery because the patients actually survive longer with the surgery compared to without surgery. Or compared to stenting, but it's not that the life expectancy is equal to the normal population after the surgery. But these patients do very well.
Illness of the disease that the patient already has.
It's related. It depends on the severity of the disease they have, and that's why we cannot say that they have an equal life expectancy than normal population. But with the surgery, they do much better. They can live a normal life. They have, after surgery and after the rehabilitation, they feel much better than without the surgery and then before. So it's a very good operation. That's why we perform coronary artery bypass surgery so often, and it's in the whole world. So this is a very common operation, and it's very good. That's why it's so common. But yes, I said the life expectancy is not as in normal people.
Mm-hmm. Okay. Well, thank you, Professor Grünenfelder. I learned a lot. Much appreciated. Thank you for taking the time, and we'll be in touch shortly.
Thank you very much.
Thank you.
Hey.